Hey. So, good afternoon, everyone. Welcome to Black Table Talk as hosted by the Alliant LA-Campus Black Student Alliance. My name is Bianca Broomfield, and I serve as the chair-elect of BSA on this campus. We are so excited to have you join us this afternoon for an engaging discussion centering on Black mental health and multicultural understanding. We are honored to welcome Dr. Elizabeth Burke, an esteemed assistant professor at the University of the West, as our guest speaker. Dr. Burke brings a wealth of knowledge with a BA in linguistics from UCLA and a PsyD in clinical psychology from Pepperdine University. She is a specialist in multicultural mental health with a focus on trauma and its transgenerational impacts. Her work integrates neuroscience, humanistic psychology, African-centered psychology, Buddhist psychology, and behavioral therapies. A passionate advocate for literacy and mental health in underserved populations, Dr. Burke is a dynamic public speaker and a dedicated mother of three. So, thank you so much for joining us, Dr. Burke. The floor is yours.
Thank you so much for having me. Thank you so much. I thank you for that introduction. I think the copy that you may have received was a little bit years back. I actually became the chair of that psychology department at that small Buddhist-based university and served there for 5 years. And it was a really great experience. In addition to that, I'm also a current adjunct professor at Pepperdine University and LMU. And I also have been a guest lecturer at various universities such as USC, UCLA, UC Berkeley. However, as you were talking about, my true passion is really helping clients and patients understand how to heal themselves from negative beliefs as well as past traumas that have been passed down to them personally, interpersonally, or have been passed down transgenerationally. And that's what we're here to talk about today. So I, I love being interactive. So if I happen to say something, please, let me know. Raise your hand if you have a question so that I can expand upon things or I can go into more detail. Or I've been practicing for the past 24 years. So there's so much information that I hold. So if there is a nuance that I've forgotten as I was talking to Bianca before we started, that there's so much information, and I know that I want to be as helpful as possible to the new clinicians coming in. And so, Bianca, if you could help me, if someone has a question, that would be great. I'd love to just answer it interactively.
Absolutely.
Okay. So where should we start? What are the things that um, how can I be most helpful in this time that we have together to really understand how all of this works? Where do you think we should start?
I think for I looking at our audience, I see a range of students who some of which are in their first year in our program. And so I think getting a greater understanding of transgenerational trauma in general and how it even impacts and influences the Black community would be a great place to start.
Yeah, okay. I want to start with this. It's this cute little diagram and article by Tori G. DeAngelis. And let me just share this. I'm going to I can put this in our chat here. Here we go. Okay, you know what? Maybe I can, forgive me. Maybe I can just share with you my screen. of what's going on here. And really allow you to take a look at this. So transgenerational trauma, um, it's really about, forgive me, this is such a cute little graphic here that I'm going to see if I can. Okay, so go. I'm going to share my screen with you all. You know what? Forgive me. I don't think I have a share my screen
Oh,
capabilities.
you absolutely should. I can fix that right now.
It's okay. Okay. Okay, here we go. Share screen.
Okay, it should allow you to share your screen.
Wonderful. Wonderful. Here we go. So I want to share this with all of you because I really want you to take a look at this right here and how if you look here at transgenerational trauma and how is it that under really understanding transgenerational trauma, well, there's traumas that happen to us, that happen to our ancestors, actually, like our parents, our parents' parents, and our parents before them. And then here's just an example. So for Europeans, possibly surviving the European wars, and then we have this example of Jane, and then we also have an African American example, Ashanti, and then we have a British India um, individual by the name of Ashok here. So we have all these things that happened during the European wars. And for example, Jane's great great grandparents, they had traumas that happened to them during these wars that they had to survive through. And then these traumas and ways of life were passed down. So it's really important to understand that transgenerational trauma comes out of the need to survive. So when we understand that there was a need to survive and how important this was, right? So you want your offspring to survive. So you create these ways of how do we survive in these very harsh environments? And then it just becomes a way of life. And then this way of life gets passed down to your children. And then it's just a way of beingness. And this way of beingness is a part of survival. It's we've learned that this is what we need to move on to survive. And so this is how what our children need. And then some of these things are even passed down silently. It's an attitude, it's an approach, it's the way in which we interact with others, right? Carefully, making sure not to offend or be in harm's way or to hurt ourselves or the other people that we love around us. So, for example, we have here the surviving the European wars. Traumas get passed down through the generations. There's post-traumatic stress disorder, alcoholism in order to survive it, sexual abuse, as well as emotional repression, right? Now, understanding that some of these things are happening culturally, especially when we see here at the bottom for Jane, it's emotional repression, right? And I really want to highlight the difference between suppression and repression here. Suppression is when we are consciously aware that something negative or makes us feel negative is actually consciously being pushed down. Like, I'm not going to think of that. I'm not going to go there. And I'm just going to push that down. I am consciously not going to go there. But repression is when over time, again and again and again, you've been told or made to feel ashamed, guilty, that there's something wrong with you, that you have an issue or a problem if you were to bring these things up. So every time that feeling or every time that thing comes up, there's a subconscious, natural way that you protect yourself. You're protecting the organism. And so you push it down, but subconsciously. And that's repression. I just really want to understand you to understand the distinction between suppression and repression because individuals, as with the definition that I explained, are not actually aware that they're repressing things, right? So this is really important when we're trying to understand intergenerational trauma and transgenerational trauma. Both terms are interchangeable. But I really want to focus here because we are the Black Student Alliance here. And we really want to look at, well, what about surviving slavery and racial violence in the South America, right? Excuse me, in the American South, the southern part of America. So let's look at Ashanti, her great-great-grandparents. Traumas were passed down through the generation. A lot of abandonment because there was forced abandonment during the era of bondage in our nation and our history. And then a bunch of domestic violence because violence was a part of just everyday life. You had to endure a certain level, a certain amount of violence every day, and which created a low self-esteem. Now, low self-esteem, if you think about it, is adaptive for survival. Because if back in the days of the era of bondage, and when being an enslaved person, you couldn't have a high self-esteem. Say, hey, that you're disrespecting me, and I'm not going to take that. That would lead to your death, right? Could very much lead to your death, or really, really getting you injured and hurt. Um, So understanding that individuals learn low self-esteem and to act in low self-esteem and believe themselves to have low self-esteem as a form of survival. Because if you're small and you make yourself small and you don't speak and you don't talk and I'm not going to cause any trouble, then okay, you're not a threat. You can be around. And guess what? We don't have to beat you so bad. We don't have to put you through all of this hurt and pain and violence because you are very safe to a person who is attempting to oppress you. You're showing that it's okay, I'll stay oppressed, right? And then hence we have complex post-traumatic stress disorder where there's so many traumas that are happening all at once that we developed this complex PTSD. There's debate in the literature whether complex PTSD is interchangeable with borderline personality disorder and all of those things. However, it's important to understand that this is how difficult it is. Now, there are definitely some researchers who are like, these are delineation between complex post-traumatic stress disorder because we have to look at all the various stressors and then be able to heal from that place, whereas borderline personality disorder is more specific to environment and temperament and things like that. However, it's also just to bring this point, it's not just Black people and Black people throughout the diaspora, but as you can see here, there's also oppression that happened in British Columbia, where there were traumas that were passed down. And for example, like this poverty consciousness, we also can see this in the Black community as well. Like if there were rules and laws, and you think about our history in the Jim Crow era, where there were rules and laws that you were to stay in poverty, right? And that if you were to stay in poverty, then you weren't a threat. And then there were also things that happened historically in America where if you were in poverty, then you're okay. But in and even I don't know if you've many of you heard of the story of Black Wall Street, that when Black people in America started making too much money, what did they do? They burned the whole town down and everyone in it, right? And then filled it up with water and made a man-made lake. I don't know if many of you have heard of this one comedic writer. Her name is Amber Ruffin. I love her. She did this segment about all the American-made lakes, the man-made lakes. And it's a really great piece if you were to look at it, Amber Ruffin. And she talks about the history of the man-made lakes, and all of them were towns of Black people that were doing really well for themselves in that area. And then people got upset. Racism was so flourishing, and anger and so much upsetness, that one of the things that happened was that they just got upset. They burned the whole town down. And then after they burned the whole town down, they filled it with water, and it's a bunch of these man-made lakes. Now, it's interesting because with global warming and things like that, the water started to dry up because we started to get hot and hotter climates. And then what do you know? People are finding like there's a whole town underneath this lake. Where did this come from? Trauma that people had to endure, especially Black people had to endure in America. So when we think of transgenerational trauma, and I want to be able to share this with you, and I'm gonna give this information. I'm gonna send this information to Bianca for anyone who's interested, and we can share these links. However, when we understand that transgenerational trauma is often silent, these are things that are passed down. And when we think about how is it that we can actually heal from transgenerational trauma and how to help others heal from transgenerational trauma, understanding that transgenerational trauma was a form of survival, that it had a purpose that helped us to survive, that helped us to get through and live on to the next day, which is extremely important, and how we are working from a subconscious place and bringing that subconscious action conscious. We're able to review it and understand, does this actually still serve me? Is this actually helpful? And giving honor to our ancestors for surviving, for helping us, for teaching us how to survive, and having that gratitude and having that love for that. And then being able to say, thank you, ancestors. Thank you for helping me. Thank you for allowing me to live to see this day. And thank you for everything that you've done. Yet, as I review my life and as I review what's happening now, these ways of survival do not help me survive anymore. They're actually hindering me from progress because we have actually grown and have moved forward and have matured and grown to have more respect for each other in various ways. So that's transgenerational trauma, intergenerational trauma in a nutshell, if you will.
Wow. Wow. I know what's really resonating for me is I love how you acknowledge our ancestors in this conversation of intergenerational trauma. And I love how you express gratitude for their survival and how that afforded us a greater opportunity. And recognizing that now, okay, we are moving past that place of hurt while also recognizing the work that our ancestors did in order to get us to this new place. And throughout this whole, I've seen new people come in, but I want to reiterate that you are more than welcome to ask questions, engage with our speaker, comment in the chat, or take yourself off mute. But you touched on how as clinicians we begin having these conversations with our clients and recognizing the presentation of intergenerational trauma in their lives. I'm wondering how, as clinicians, as we're all in different spots in our career, as clinicians, how do we navigate intergenerational trauma with our clients and facilitate healing that's going to begin to disrupt that cycle?
Well, first, when we're talking about clients, you really would need to understand and have an understanding of a little bit of the cultural background of the client that you're attempting to serve. So I've had a lot of great mentors and a lot of great teachers who have helped me and pointed me in the direction of if you don't understand the culture, then you need to figure it out. It is your job to have an understanding of what's going on culturally. And then you won't actually understand how your client interacts with that culture. You only have a general knowledge or understanding. However, if you're going to be of service, then you need to take the time to understand what is happening culturally with that client. It's even important. You can start with, are there any current events that are happening culturally? There's a lot of things happening in the world, right? I remember I was working with a client who was Nigerian a couple of years ago when there was it was during the George Floyd and Black Lives Matter movement. But in Nigeria, there was young people who were just getting shot in the street and being killed. And it was an outrage. Doing a deep dive to really help and understand my client about what was going on. And at that time, culturally, there's a cultural understanding of there's levels of hierarchy socially, and it doesn't matter. It's a delineation by age, and it's the older you are, the more respect you have. And then there's a cultural thing where younger people are to just obey really what their parents or grandparents or elders have said. But it's interesting because as we talk about the new generation was more, why? Why do I have to do that? And this is great with so millennials, and this is in understanding the generations, and I want to talk about the generations as well because it's important to understand where individuals are coming from and who they were raised by and how they've come to these ideas, right? And when you understand what's happening generationally, then you can also get a better understanding of why does this even occur? So for example, just continuing with the story, is that culturally, the Nigerian culture was very much you respect your elders, the end. You don't talk back to your elders, the end. However, the young people are like, this is unfair. I'm being mistreated. You're disrespecting me. No, I'm not going to listen to what you said, officer. I didn't do anything wrong. You're being rude to me and you're abusing your power. The disrespect and the culture from the elder standpoint was so huge because were generations of a young people living their lives feeling as though I have to just do what is told to me. I have to just do what they say. And then one day I will be older. And then I will be able to tell everyone younger than me what to do. And then I will be able to have the power. And this is how it's gone from generation after generation after generation after generation. But the wonderful, beautiful young people, the millennials were like, why? This is the Y generation, right? And they weren't having it. Unfortunately, some people were getting shot in the instant. When you try to break what was happening for so long too quickly, people have a big reaction. And it could lead to pain, violence, and even death. So we want to approach shifting this ideas of the things that have oppressed us transgenerationally, the things that have hurt us. We want to shift it slowly. and going at the pace in which the other person is able to do so and is ready to do so. We have a question.
I actually just am so grateful to hear all of this. I think you blew my mind with the gratitude and for our ancestors, with the understanding how you really shaped out these are survival mechanisms. Making yourself smaller was a means to survive, which really gives it sounds so simple by you saying it, but it's something that just really, really shifted me as I would sit in my clinician seat, if I'm sitting across from somebody who has low self-value, understanding the historical aspects of this as a Black American, having so much intergenerational trauma of making yourself smaller in order to survive. But then you talk about that shift. It was just, as you said, that was like, wow, okay. Because it really gives better context to the sense of self, not only in the modern day sense of self, but the historical aspects of it. And I just really appreciated that. And I wanted to make a comment of that. And then I think just that cultural humility and that sensitivity to our clients as professionals and what that looks like as that transition's being made is really interesting to me. So I love hearing you talk about that. And I would just wonder, like, is there a process that you've discovered in your work as far as that transition phase? If there's this sense of like, you're saying the millennials, but is there's this sense of readiness that you see? And at what point, if I know every individual's in, of their own, but is there this kind of moment where you see this almost like a gridlock between a person fighting cultural values that have been ingrained through trauma versus the present day speaking up, and how that shift occurs with ease because there's so much turmoil of like that frustration of wanting to break from oppression and the repression.
Great question. Great question. And you're right, it is difficult because the reality is that we have people that we know and love who were raised in ignorance, and not ignorance in a negative sense, but just ignorance in a sense of they just didn't know.
Yeah.
And there's no judgment there. They just didn't know. And so they stick to these ideas of this old way that was very much a part of their survival. And then they want to enforce upon their young people that this is how you survive. I've survived this whole time. I'm 70 years old and I've survived this whole time. And this is a proven way to survive. And you can't go against that. And there could be individuals who are elderly who do not understand that the world is changing and the world has changed because they live in a particular bubble. And we as Black people, there's our individualistic self, and then there's our community self. And we think of the community, we think of our families, we think of all these individuals, and we're really, really big culturally on respect. And why are we so big on respect when we think about historically what has happened, where we didn't have the privilege for centuries of being respected? And that was taken from us. So we've grown even epigenetically to have a sensitivity towards being disrespected, right? Whereas someone else would be like, oh my gosh, how annoying, right? But then we as Black people are like, how dare you speak to me in this way, right? Where we want to demand it because we've had to endure it and hear stories of enduring disrespect, and we no longer have to stand for it. So I say this because we still are big on respecting our elders. And sometimes we have to, let them know what the truth is and be like, well, okay, great Nana, I understand. The world's changing, great Nana, but I love you. And then you give her a kiss and you pass her favorite blanket and you walk out the door, and then you go on making changes to individuals who are ready in their hearts to make these changes that care for everyone. We don't have to upset or disrespect our elders that came before us, that helped us to survive to get here. We don't have to do that. But we can acknowledge that they're not ready to make the change. And you can't make anyone change. It is a willingness in one's heart to want to, where we start to see ourselves as greater than we've ever been before, and then recognizing that in each other and calling that out and speaking and acting from that place. That is how we begin to bridge this gap, because there's always respect, there's always honor to our elders, even those who are still steeped in ignorance, but they're trying so hard to save us and protect us. But they don't know that that world is that they were part of is dying, and so are the ideas with it, right? But we have new ideas and new ways of being. One of the things that's really important to understand, especially when you're working with transgenerational trauma and clients, is to really understand, like, well, first of all, the age of your client and who you're working with and things like that. I want to just talk about the generations really quickly so you can get an understanding, and I want to get back to those questions in the chat. So let's talk about the generations of the silent generation. The silent generation was a generation during World War I and the Great Depression. Now, the silent generation visually seen and experienced so many atrocities that they weren't able to speak. And if they tried to speak up on it, it could lead to their death. Because this was a time where there was oppression. The era of bondage was very much where human trafficking was monetized, and people were making so much money that you couldn't say that this wasn't an okay practice, because people are like, well, I'll kill you for my money, so don't go there. You cannot speak publicly about this. And how people were being dehumanized, and how people were treated, and how this understanding of it's okay to dehumanize people, it's okay to human traffic people, it's okay, it's legally happening, and it's in the laws, and it's all right. They learned to be silent, because if they weren't silent, they would die. It's the silent generation. And then they taught their children, the baby boomers, to be silent. And then the baby boomers, they taught them to be silent, but they were like, look, it's the 50s now. Okay. And you have all this animation. Now it's like you don't have to wash dishes. You have a dishwasher. You have all of these electronics, all of these wonderful things. Matter of fact, all the atrocities that that are still occurring, and the oppression and the racism and all of those things that are still ugly. Matter of fact, why don't you just drink a lot of alcohol and smoke a lot of cigarettes? Because that's what everyone was doing. It was so common to have an office job, and everyone just has their full cart of alcohol, their bar cart, where everyone's just having martinis and drinking at work and smoking cigarettes all day. And then there was a lot of uppers and downers that housewives were able to have. And then there was a whole book about why are housewives so depressed when they've never had it? Women have had it so easy. Why are they so depressed? Because everyone is attempting to numb, to stay silent. Baby boomers. The baby boomers raised Generation X, where we had to follow these rules. And if Generation X was, you can still get beaten in public, you can still get hit by your neighbors. If they thought that you should get beaten, you could. All of this stuff was legal. This wasn't illegal. So it was like Gen Xers learned, I gotta follow these rules, man. I gotta follow these rules. So at least to prevent abuse or harm happening to me. I just got to follow these rules, man. If I could just follow these rules. And then and the baby boomers were able to check out, right? Gen X raised Gen Ys, and Gen Ys, Generation Y, such a beautifully named generation, were the first to ask, why? Wait, why are we following these rules? What are these rules for? Who is benefiting from these rules? How come it just feels like I have to endure all this pain? Matter of fact, why are you subjugating me? Why are you saying that I have to be this way or that way? Why can't I be me? Gen Y are so awesome. They were like, you know what? Bump binary. We're going to think of something else. We're not even binary anymore. We're all the things. We're different, like things that Gen X was too afraid to say because we were concerned about being harmed or hurt or killed. Um, but Gen Y was like, I don't even care. I want to know why. And then this gave rise to our Gen Z, who were all born with a predisposition to be emotionally more sensitive. And I don't think that's a coincidence because Gen Z is ushering in a new generation where Gen Z feels for themselves and for others, and they feel it and they feel it deeply. And then this is being passed on to Gen Alpha, who are now in elementary school. So when we think about transgenerational trauma, we have to think about what age are they? Who are they raised by? And then how much is this idea of you must be silent to survive has been ingrained in their survival. So how much of that is happening? And then also understanding, we're especially thinking about serving the Black community. There's a lot of privateness that goes on in the Black community because this is historically necessary. This was a historical way of survival where, we were forced during the era of bondage to not have that privacy. We were forced to even have intimate sexual relations in front of the slave masters and things like that. We didn't have the rights over our own bodies. There was a lot of things that were not private at all. Human decency of just even using the restroom, we weren't even able to do so. But now this is why we're so big on our privacy and making sure that that's the case. Lola, do you have a question? Oh no. Okay. So it's really important that when we're starting to serve our clients in this way, that we understand what is the thing that's preventing them, because you have clients that are really soft, that take time to open up. And it's not that they're being resistant, it's just that they're being cautious. They're being careful. And respect is earned while it's given. So you have to give your client that respect that they will eventually open up over time, because we have been taught as a survival mechanism to not trust. The medical system, all of us are clinicians. We're a part of this bigger system that has been abusive to people of color in the past. And so being sensitive to that, and then letting your client know that that's not where I'm coming from. And all disclosures to the client will be in service of the client. So it's really important to understand that, and especially when we're talking about clients who are private, really highlighting as you open up your session with the script that we have of being a mandated reporter, letting them know that I take my time letting clients know that as a mandated reporter, these are the things that I am mandated to report, and really reiterating that and saying like, now, when we go into talking about your life and things like that, I want to be very respectful of all the things that have happened to you. However, I'm a mandated reporter. And so when we start to approach the subject that gets to the things that I'm reporting, because I'm a reporter, I'm not a detective, but I am a reporter. So if I am very clear to you what I need to report, I want you to know that if you share these things with me as a mandated reporter, I no longer have a choice. I have to report. So I will remind you as we start to get to these very more sensitive topics, that I am a mandated reporter and I'm mandated to report this, that, and that third. So really highlighting that to clients that are really private and clients that you know have had to endure a lot that are no longer, it's no longer illegal. If you're talking to a Gen Xer and you're just like, I used to get beaten by my mom, I had to go pick the switch. It was all of it. It's like, okay. And then so I did that to my kids. Like, whoa. When you start to say, I've been beat, all these things, you're like, well, let me remind you, let me jump in. I'm a mandated reporter. And all those, and I'm so sorry all those things happened to you. You know that all of that is illegal today, is completely illegal. And I would be forced to report incidences that happen to what happened to you. If it happened to someone that you know or is in your care today, it would be imperative for me to report that as a mandated reporter. So when you share these things with me, please know that if you do, then I don't have a choice and you want me to report it. I'm going to take it as you want me to report it because that's the only choice that I have. So just being very aware of that. I also wanted to get to, there were some questions that came up in the
I
chat.
had a statement that I wanted to make to you, Dr. Burke. Number one, thank you for sharing everything that you've shared today. Very much so resonated with me. As co-chair, I've also just discussed with Miss Brittany Bell and Miss Bianca Broomfield about transgenerational trauma and resiliency and how everyone has just a different response with their stress responses and how to meet our clients where they're at because of it. It was just like a week ago. I was just having this conversation with Brittany about in Black culture, especially with all that we have gone through, there is still like a large population that is addicted to stress hormones and how trying to navigate that with our clients, especially when I worked in the middle schools, like that was just rampant in terms of violence and things of that nature and just sort of that idea of like proving yourself to, be as strong and as resilient as possible, but also wanting to look as good in front of your peers or, whatever the case may be, depending on the population. And so, yeah, just as much as we have those that are addicted to, the dopaminergic, all of that, like really high energy things, there's still those clients that have the stress response to fawning. The low self-esteem is there. And so you become very docile and become very passive and your attachment style might be connected to that. And so I say all that to say of dealing with these different clients, it really, it brings me back to that statement that you had made earlier about um, just meeting the client depending on what the context is and how important that is. Because I've been on each end of the fight or flight with the client or the one that has been completely paralyzed from the anxiety or the fear that they've experienced in the complex PTSD. So once again, just thank you so much for that.
Oh, you're so very welcome. And thank you for pointing that out. I love that you were talking about the context, right? Because the context is, and I love that you're saying this because the environment in which we live in really plays a role on how we move forward and the things that we pass on. Just take, for example, epigenetics, right? Epigeneticism is where, and just briefly talking about this, is where we all have, every cell has our DNA and our genes. However, it's the environment around the cell that really lets the cell know, is it safe or is it not safe? And over time, if the environment is consistently unsafe, then the cell learns over time, it would be more to my survival benefit if these genes turned off and then these certain genes turned on. Now, the DNA doesn't change, but the turning on and off of the expression of certain genes does change within the environment over time. It can change over a generation, right? And so you could be in an environment, very harsh environment where there are your genes are like, wait a minute. This is not helping us survive. We need to shut that down. We have to stop that. We can't do that. And then that's what gets passed down. Now, the environment that the original experiencer may have changed, but the genetic code is still, of the genes being turned on and off, are still passed down to the children. And then they're still operating in this way. And so it's important that we understand our belief systems, how we think of the world, and our belief systems and how we think of the world and how that's passed down. And all of that is shaped by environment. So thank you so much, Paige, for pointing that out. Great questions. Yes, Isaiah?
Wait. Yeah, hello. I'm Isaiah. I just first want to introduce myself. Thank you, Dr. Burke. Really glad to be here. I'm actually not from this school. I'm from Chicago. They connected with me. I run the Black Student Union here. So really happy to be here and hear this great event. It's really nice to hear from you. About intergenerational trauma, I find everything you said really accurate and true and interesting. And I just kind of looking at it, I'm noticing like it's kind of a really nefarious thing where like even when generations take a win in breaking a cycle, a new cycle like starts. Like kind of like in the chart you said, like, you might be free from bondage, but now, there's now a cycle of maybe domestic violence, or maybe you beat that, and now there's a new cycle of low self-esteem. And so I'm kind of wondering, like, from your experience, how do you teach clients, maybe particularly like parents, like what can you like, because we know like bad things can be passed down intergenerationally, but like, is there things we can pass down? Can we use that mechanism for ourselves to pass down something that will help combat that, and like, pass down something that will break those traumas, or like kind of give them something to combat and kind of break that. We probably inevitably will pass down something ourselves as much as we try to break the, cycles that are before us. We might pass down something else. But is there a way that we can be proactive and pass down something purposefully that could give younger generations a better chance at, dismantling whatever it is that we pass down and then starting fresh? That's kind of my question. It's my compound question, but yeah.
Yeah. See, this is what a great question. And thank you so much for your question, Isaiah. It's a good one because you're making me think of the years that I've been doing this and what has been effective and helpful. And when it gets down to it, what I've found is that people becoming aware of the choices that they make, if these choices that they make are empowering to them and themselves and the life that they want for themselves or not. Sometimes we do things like we were talking about, repression and subconscious behavior and all of these things. Like this is not conscious. We're literally like, well, this is what, my mama said to do, and this is what her mama told my mama to do, and this is what my mama's mama before that said to do. And so I'm just doing what they said to do because this is what they said to do. And I'm not even thinking about my great grandmother passing this down and creating this scenario during a time where it was a part of her survival. I'm thinking, this is how they told me how to do it, so I'm gonna do it like this. And so then it's so subconscious, not even conscious. It's like, well, wait a minute. You're doing that, but how does that serve you? How does that help you? How is that helping to empower the life that you want for yourself? And can we honor what our great grandmother, grandfather has taught us, because they helped us to survive? It goes back to what we started with. How can we honor them and say, thank you so much? I understand that back then you weren't able to do what I'm able to do. And it's because of you I can do something different. And I can loudly to the world be empowered in who I am and stand in who I am and let the whole world know, but grandmama, you couldn't. Granddaddy, you couldn't. I can. And so when it becomes conscious, when it becomes really conscious that they have the ability to make these changes and they don't have to pass this down anymore, the person, the individual, makes the decision to want a better life and will continue to practice doing that. And so it's not a point of shame, it's a point of empowerment that my ancestors did so much. They had to make themselves so small just so I can be here today. And I will stand tall, and I will stand proud, and I will be exactly who I am. And I will make everyone, ancestors and beyond, proud to be here. Me, I get to live the dream that they were fighting to have. Great question, Isaiah.
Yeah, thank you so much for that response. And what I'm hearing is that, the thing we can kind of try to give the future generations is like encourage that awareness. That's like seems to be like I don't know, shifting point of like, if you can get people to be aware of these patterns, then they have the ability to break them quicker. So like, not just allowing like, like children to like, be a question or criticize things we do, but like encouraging them to do so that they can like look and find something that they might get from us that doesn't serve them and throw it away, quickly, while still
Exactly.
honoring before and stuff like that.
Yes, not necessarily throw it away, but
Yeah.
recognizing that it had a purpose and that's no longer necessary. Thank you so much, Grandmommy. Thank you so much, ancestors. Thank you so much for teaching me. And thank you for surviving and allowing me to be here today. That has its place. And now I'm here. Thank you for paving the way for me. And now I'm here to be freer. I love that. Thank you so much. So, Ngozi?
Yes, yep, you got it right. So thank you so much, Dr. Burke, for this conversation. One of the questions that I had is, I am of Nigerian background, and oftentimes they are very stuck in their ways, and they expect their child or etc. to also do the same thing that they did and have that same mindset. What are some ways that you can teach people to not honor their grandparents and parents, but use that and change essentially? How do you, I don't know, it's how do you create a way for them to follow their own path while still honoring their grandparents?
It's interesting because it depends, right? Because now we have to go back to talking about environment. So it's much easier to create a change or shift in a change when the environment does not oppress you to do exactly as it's been done generation after generation after generation. So what ends up happening, Ngozi, you're here in the States. And you can go to certain areas and certain places and in certain environments where that type of pressure doesn't exist, right? But you can go back home and have like a family event with all the generations, or you can even go back home to Nigeria where the pressure is even more so, right? So you're able to express in places that are safe for you to do so. You still get to be you. And depending on How open are your grandparents? How open are your parents to this, right? And how you can talk to them and explain to them, like they want to feel respected because they weren't respected. So you always want to make sure that you're showing that reverence and that respect. You always want to make sure you're doing that. Otherwise, you're going to get this pushback, this unnecessary pushback. The point is not for you to be disrespectful. The point is for you to be free. So allowing yourself to respect your grandparents and even telling them, I'm so grateful that you had to go through what you had to go through and you did everything you had to go through. But you know what, grandmommy, grandpappy, like the reason why I'm able to have a voice is because of you. The reason why I can even be free is because of you. And I thank you and I honor you and I respect you. Now, grandmommy, grandpappy, depending on how close you are with them, I'm not going to do it in front of you, but I am going to do it in the circles in which I can. And I am going to speak out and I am going to have my voice. But I want you to know that I honor and respect everything you've done. Thank you so much. And then you moonwalk out of there and you go on about your life and continue growing and serving and helping. How does that sound, Ngozi?
That sounds great. Thank you so much for sharing.
You're so welcome.
Wow. Oh, I'm sorry.
No, I was just going to say that there's still other questions, but I know that we're running short on time here.
We are, and I just want to say, wow, this was such a necessary and transformative discussion. It is so important that we understand the complexities of intergenerational trauma and how to move toward a place of self-awareness and empowerment while acknowledging our ancestors as forerunners of our freedom. This does conclude our Black Table Talk. I see in the chat some people have clients and classes and things. So I just wanted to say thank you, Dr. Burke, for spending this hour with us and lending your expertise to our students, to our faculty. Thank you to the BSA e-board members, general members, and Alliance students and guests for joining us today. This segment was recorded, and so it will be posted on our BSA LA Campus YouTube channel next week. So everyone be on the lookout for a link to the video from our organization. Thank you, everyone, and I hope you all have a wonderful day.
Thanks for having me.
Thank you.
Thanks, guys.
Thank you.
Sure.